Yeah, we just have to
Take care of them.
not play so hard.
Oh, apparently.
Yeah.
Hopefully it'll be better tomorrow.
It's pretty much every day.
Welcome, everybody. First annual progress report on the Healthy Together community. I'm Justin Mergel. I'm the peer review CEO as of for 5 months now. It's been trial by fire, I should say. I'm also on the Healthy Together steering committee. Thank you, St. Pete's, for the treats, goodies. Please feel free to get up and grab yourself something. At this time, I'd like to introduce the steering committee. Amy Emmert, Haley Weismiller, Population Health, St. Peter's Health. Stand up. Raise your hand. Lori Lattice, who's the director for Rocky Mountain Development Council. She's not here. She's the one that's actually supposed to be the first presenter. So sorry you get me. Emily McVeigh with United Way. Brenda Neiman, Health Officer for Lewis and Clark County. Julie Burr, Connect Referral. And
Dorota Capernetto.
Dorota Capernetto.
She's in Poland.
She's important. So I just got this script, so bear with me. I'm gonna kind of go back and forth reading off of it. Healthy Together is an ongoing partnership among agencies in Lewis and Clark County that are dedicated to improving health of all county residents. The partnership was formalized in October of 2017. The purpose of Healthy Together is to work strategically, comprehensively, collectively toward improving the health of Lewis and Clark County residents. The primary goals are to produce every 3 years a community health improvement plan. And that's what we're here today is to see where we're at on that improvement plan in this first year. Lost my spot, sorry. The assessment of the public health needs in the county, identifying priority issues, considering strategies, resources to address them. The partnership monitors and records progress on health improvement annually. You can also find this online. We have a few packets on the table there, but you can also find it online. It's a very useful tool. The Community Health Improvement Planning Process, or CHIP, which also occurs every 3 years, is an opportunity to develop common agenda for the entire community. It helps everyone to focus energy, resources, and support services, policy, projects, and programs that will most effective in improving the health of our community. The result of CHIP process in 2022 was a health improvement plan that describes how participating community organizations can work together to improve health of our population in 3 priority areas: chronic disease, housing, and behavioral health. You'll hear those updates today from the subject matter experts or the coalition leads on that. In each of these 3 priority areas, several cross-cutting issues were considered: access to care, community partnerships, health equity, and the health of specific vulnerable populations, early childhood, youth, and older adults. Because the plan was created based on greatest needs identified in the 2021 Community Health Assessment, and many community partners participate in the development of the plan, it becomes a powerful tool to collaborate to work towards overall better health outcomes for our county. Today is our opportunity to share the progress made in the first year toward goals and objectives set in 2022 Community Health Improvement Plan, or CHIP. You will hear from the work group and coalition leaders who have been working diligently towards achieving CHIP goals and objectives over the last year. With that, I want to introduce Sarah Sandow, the Healthy Communities Coalition address the chronic disease priority area.
Hi everyone, I'm Sarah Sandow. I'm the Prevention Program Supervisor at Lewis and Clark Public Health.
I am the chair of the Healthy Communities Coalition, which is a chronic disease prevention coalition that's been going for about 10 years now. It's changed in its forms throughout that time, but right now we have 2 active work groups, which is our Aging Well work group and our food, nutrition, and physical activity work. And that's the Healthy Together steering. And then so the first goal of the chronic disease section of the community health improvement plan is to design culturally responsive policies, systems, and environments in Lewis and Clark County for making choice the easy choice. That all community members can thrive in a culture that sustains health and prevents chronic disease. So really looking at the system of what leads to having chronic disease, and once you have it, being able to have a system that really supports people in living the healthy life that they should have access to. So the success so far is what is in the community health improvement plan are really big system-wide changes. So the first one is around a safe, accessible, healthy, affordable food system. The second one is around safe and accessible physical activity opportunities. And the third goal is around community clinical linkages. So how do we connect all the community services back to our medical services and vice versa so that we're not all in our silos. And those are really big goals from a small coalition. So what we did is we got a CDC grant, a Centers for Disease Control grant, for a year to help us plan this out. So we received the grant and we were able to hire some consultants to help us through this process, making sure that we're interviewing the community, specific people that maybe their voices wouldn't have been heard otherwise. We looked at data, we looked at other groups, what they're doing, we kind of looked where the community was going. And the development of this social determinants of health accelerator plan was born. And so social determinants of health is where people work, live, play. It's where people, it's our education, it's our access to food, it's where we live. It's all of the factors that go into our health and what makes us healthy or not healthy. And so they really looked at those specific factors and saying, how do those lead to chronic disease and what can we do about it? Using the same goals listed on the chip. And so we're in the final development stages. I have some leadership team members here with me today. Thank you so much for being a part of it. And so it's been about 8-month process so far to develop this plan. And so while we were developing the plan, which will launch in the next few weeks, and we hope that anyone who wants to be a part of it is a part of it, while we start to launch that, we were also having a few short-term successes. We had a healthy living challenge, so that's really aimed at community members who maybe want to try a new habit, something Helena want to explore, a way to encourage in a community-wide level campaign. So there's 14 challenges, such as grow a new produce. Another one would be hike a trail in Helena. Maybe one of the accessible ones. There's options as go to Spring Meadow Park specifically. So there's a different options, and if you do 10 events, enter in for a prize that local businesses volunteered for. So that is one challenge we have going. The other is the farmers market bingo. So that is, if you can see this little box right here, it's a bingo card, but it's a way for families to engage more at farmers market. So how do we have families talking about nutrition and physical activity in a fun and exciting way? So for families that were already going, how do you engage more? And then for families who weren't going, maybe this is a reason to go. And so it says things like find a rough textured fruit or vegetable, do 10 jumping jacks, find the fruit you like. And so we had them at a few booths for a few times. And then we also had the school send it out. We had coalition send it out. We posted it on social media. So there were some opportunities. There was no prize for this one. It was really just a fun way to engage, but something we will evaluate and see what to improve for next year. So those are two of the strategies that while we're doing big term planning, we want to make sure we're doing the small efforts that are quick turnarounds as well. So the challenges and barriers, one is finding funding for implementation. So these big systems change take a lot of money. Whether it's getting them going, whether it's how to sustain them, whether it's the capacity to just work on it. So we're looking for some funding for implementation and also coalition capacity. Since we don't have staff time just to continually work on it, we're asking a lot of volunteers to donate their time to be on these leadership teams, to be on these work groups, to spend time on these efforts. And that's what makes it really successful. But it also can be a challenge, you know, asking people who are already very busy to donate more time. So making it really meaningful of their time as well. And then next year is implementation for the plan. So now that we have this great plan, it's how do we do it? And so we do have steps of what we will start doing, what it's going to look like, and we'll have that plan posted to our website once it's finalized, so by the end of September. And with that, I'm actually going to now go on to behavioral health section, which is priority area number 2, with Jess Hegstrom and Jolene Jennings.
My name is Jess Hegstrom. I'm the Suicide Prevention Coordinator at Lewis and Clark Public Health, and I'm joined here by my colleague, Jolene.
Jolene Jennings, Behavioral Health Systems Improvement Specialist, and I work primarily on the crisis system of 3 pillars, 988, MCRT, and the crisis facility startup.
Okay, all right, so the goal of our behavioral health priority area 2 is to create an environment in our county in which the mental wellness of every resident is supported and all are empowered to live free from substance misuse or abuse.
So the 2 areas that we identified for key goals that we wanted to report on, that I wanted to report on with the work that I do with the behavioral health systems improvement was, many of you know about the 988 suicide prevention and mental health crisis lifeline that was launched in July 2022, and that was here in the state and nationally that was launched. And there, many people don't know that it was a year process working with the state and the counties throughout the state with the crisis coordinators, which I'm also AKA crisis coordinator, and really going through a strategic plan process of identifying partners to work with in the community. The group that I was part of as a coalition was to really try to communicate with providers and consumers that need to access the 988 and inform individuals about the 988 and also connect it to the Montana 211 database, which is where 988 often gets their resources for referrals. So that was done by the counties without any funding, extra funding from the state. So we had to do all our marketing efforts and outreach were done without any budget. So it was a lot of hard work. As everybody knows, behavioral health systems work is challenging, both challenging and rewarding. And through perseverance in the community with people like, United Way and many others, we were able to actually increase our goal number from 152 to 596 behavioral health coded calls were received at the call center from Lewis and Clark County to the our call center in Voices of Hope in Great Falls. So we surpassed that goal with hopefully all our outreach people heard about it, and we're gonna hope to see that keep folding into people getting access to that crisis coordinator. The crisis counselor through the 988 number to be able to help talk them through a crisis for mental health or substance use disorders. Any crisis is a crisis for somebody. They identify as a crisis, get de-escalated in their de-escalated by the caller, and if not, they're able to connect them to a 911 or other services for a therapist. Maybe they have a therapist and they just haven't been able to pick up the phone and call. They'll help to connect them with that. So 84% of the calls in Lewis and Clark County have been de-escalated through the calling 988. So that's a great statistic. And Montana is one of the highest success rates across the nation. So kudos to the call centers for the work they're doing. So the other key area I wanted to talk about was we had a goal to collect robust data collection and partner with our community. And so one of the things we've done we've accomplished through being able to collect data, but also figure out a way to make it transparent and interactive with the public. And so with that, it took a good amount of time to work with our local advisory council and develop a work group to start engaging in what kind of data we could put together and what would that look like. And it really got wide quick. And so this year, 2023, the group reconnected and focused on building the behavioral health crisis system dashboard, which focuses on the three pillars of 988, person to call, MCRT, which is mobile crisis response team, a person to respond on scene typically, and then the crisis receiving a stable and/or stabilization facility, which would be a place for somebody in behavioral health crisis to go. And so those are the areas that we're working on and we're reflecting in this dashboard. We're trying to anyway. No, we're doing a great job in reflecting. Oh, just now. So I see it. So this is I'm going to stand over here so I can see this better. So this was created through the contributions from the local advisory council and many members through St. Pete's, many rivers, JP Research and Evaluation, and the public health, and Dorota Carboneto, is that how you say her last name? An epidemiologist, and I worked on trying to streamline this and make it visual, engaging, and appealing, and really give a strong understanding for everybody on the three pillars. So this front landing page is informative, and you can drop down and understand and read through more context. And then we've got the images where you can actually click on the separate dashboards where you get data to interact with, both data that is input and outcome based from the provider to the services, but also we've got data feeding in there that actually says why we need these services, right? Hospital admissions for psychiatric symptoms, and then the amount of discharges, and one of the other components is we collect the law enforcement behavioral health coded calls that are received and responded to each month, and how that adds to why we need these services beyond what we all see every day for the need for behavioral health services. So Haley wanted to click on the first pillar. At the top, you can click on the buttons, read those buttons at the top, and then you can dig deeper into the different categories. So this is the different graphs and charts that we have in there, and I'm not going to get into the details because I know we have a limited time, but you will be able to get into this yourself. We're going to be doing a press release on Monday with a link to be able to access this by the public. And so, again, a context, the narrative of what it's about, and you can drop down on the bottom to get resources to and read more. And then the key facts we get in the community from this information will be shown here on this dashboard for 988. And again, the 596 calls we referenced there. And then you can click on each graph and then expand it and download it from there. So use it within your own. So a lot of providers might use this to help them with grant writing or what do they need to do to improve their programs. So that's the 988 system. Again, we work in partnership with Voices of Hope for sharing this data with us to add this in. And then we braid in law enforcement, behavioral health, and many other pieces. Pillar 2. We call it MCRT, but the long explanation is the Mobile Crisis Response Team, which is behavioral health professionals that are actually based out of St. Pete's, the Mobile Crisis Response Team. They have behavioral professionals that are operating 24/7 along with law enforcement typically to go to respond to a behavioral health coded call to help to de-escalate the situation. And then as we can see, 589 individuals received mental health evaluation. And then 306 had a safety plan put in place. That's honestly in the community to relieve the flow into the emergency room and then provide trauma-informed services to those who are in crisis, right? Well, majority of the time in their home or in the community. And there's a lot to go through there. And we'll go to the next one is pillar 3, which is our dream pillar. It is the crisis receiving and or stabilization facility. And if we didn't have that little picture in the corner there, we'd see that's a picture of Journey Home, the old Journey Home. The intention is to reopen that. And we are working with a provider in the community to try to see that reopen. Talking about funding, which we haven't really added into this, is there's always, what we're finding is the challenge of making this open sustainable. Once we open this, we want to make sure, and the provider wants to make sure, we want to have this open and stay open and know we can rely on this service in the community. So still working on that. So we've got this hoping to be 2023, but it could also be 2024 for the launch. And so, you know, with St. Pete's ER data at the top too, we're showing, you know, the demand on services for behavioral health. So these are psychiatric symptoms for admissions and discharges. So this again is a partnership. We cannot give this story without partners contributing to this. And so we look forward to sharing this in the community with everybody. And this is we'll be updating this data quarterly and then working with partners in the community and comments that are provided by individuals to review this to be able to know how can we do better to keep improving this. What I just want to say is thank you to all the partners who worked together on this. And again, the press release will be coming out Monday. Thank you.
Thank you for sharing the data dashboard, Jolene, and for your comments about 988. Considering that our state has been the top 5 for highest rate of suicide in the nation for more than 4 decades, it's really important that we have easy access to help, and having a number that is 988 rather than 1-800-273-8255 in a moment of crisis is pretty important. So if you would mind advancing. And I can't see it very well, so I'll come over here.
Don't worry about the mic.
Okay.
You're good.
Good answer. All right. So what you should know is the suicide prevention program at Lewis and Clark Public Health does a variety of things, including making sure that community has education on suicide prevention and mental health awareness so that they know how to respond appropriately. We're really focused on empowering the community to be able to say, hey, I'm worried about you. Let's call 988, right? So for our community, under the Substance Abuse Mental Health Services Administration grant that we have funding the suicide prevention program, it's called MHAT, Mental Health Awareness Training. Just in Q3, we trained 755 people. A number of those are St. Peter's Health staff. They actually go through new employee orientation twice a month, and in part through work with Haley. Thanks for Haley. So we're making sure that our nurses, other professionals have that education, know how to talk about suicide, know how to connect people to appropriate resources. And really our first priority is those first responders, those medical and mental health professionals, but we're working with a bunch of other sectors of the community to make sure they again have those appropriate tools. That's schools, that's various nonprofits, that's construction industry. Basically what I like to say is if you have a heartbeat and you'll sit down and listen to me, I want to train you, right? So our goal is to train 1,600 a year, and we are on track for that. Hopefully we'll beat it, but with TBD, the actual grant year ends on October 1st. And then another new program that is available through our community is called our LOSS team. It stands for Local Outreach to Suicide Survivors. It's the first in Montana, but certainly not the first in the nation. There's over 30, I think closer to 40 in other states in the US. But what it is it's an active postvention model. Postvention refers to the things that we do after suicide to prevent contagion, give people the best opportunity to heal. And so for this team, what happens is we have suicide loss survivors like me and behavioral health professionals, And whenever they get a call from the coroner's office confirming a suicide, we go and we provide direct support to the family to make sure they again have the best opportunity to heal. Typically, it takes 4.5 years for your average suicide loss survivor to get any sort of services, and that's a lot of time for them to turn to maladaptive behaviors. We also know that suicide loss survivors are at a 3 times increased risk of taking their lives. So if we are helping our survivors on the upswing, we're also preventing additional deaths. So that is something that we're doing. And since we started in 2022, April 2022, we've had 48 survivors served by the team. And those people are getting access to support groups, to various information to help them heal, to dispel myths that prevent them from getting the assistance they need. And so we are pretty pleased with that. And then is it possible to move the YouTube video? Because I can't read the rest of it. I apologize.
Where the cursor is, sorry.
I think what it says is that we have 5 school districts that are delivering the Signs of Suicide program to students. So that is a developmentally appropriate program that teaches kids, ask, care, tell. Ask if you're worried about someone, are you thinking about suicide? Show that you care and then tell a trusted adult. This is something that's available in Helena schools, East Helena schools, Lincoln, Augusta, Townsend. And I think that's all of them, but it's making sure that, again, everybody has access to this information to respond appropriately regardless of your age level. And so really utilizing these basic tools and then having them go and tell a trusted adult, because we don't expect a young person to do suicide intervention, but they can show that they care. And that is a big part of this puzzle, is making sure that people feel connected. So those are some of the things that we are pleased by. And advance to the next slide, please. Challenges and barriers. I believe that this is you first, Jolene.
Okay, sure. Thank you. So again, the challenges, again, we had spoke earlier on the no county funding was provided from the state for 988 outreach and promotion. So that was a challenge to get out there, and we thank United Way for help with that outreach and other providers in the community that spread the word. And, the local advisory council that really took that and spread that out too. We typically have 25 people per month attending a monthly meeting for the local advisory council, and they were key to spreading that communication in the community too. And let's see, challenges: crisis stabilization facility slow to launch as the 3rd crisis pillar. If we were to get the crisis facility open this year or next, we would be the first in the state to have all 3 pillars operating at the same time. That is a goal for several of the Bozeman, Missoula, and us, and we are very close. And so we just need that little help, extra help, push for crisis stabilization funding to be sustainable, and keep sending that message out there. Thank you.
So a couple of other challenges. I think, we went too far. Sorry, Haley. All right. So for us, lack of capacity at one school, still in progress of a teen mental health first aid pilot. Teen mental health first aid really utilizes students to help, again, identify if someone is maybe dealing with a mental health challenge, get them to the appropriate care. We want to try and catch these things early, but we have to always think about where does best practice and the rubber of reality meet the road, right? Because we want to make sure that it's possible. So this is something that's probably going to continue into fall of 2023. Again, really make sure that students have the right tools to help each other. And then we always seem to have issues with staffing. So that has limited some progress with suicide prevention program initiatives, but we are actively in the process of hiring another person to help with our Lethal Means campaign, which really focuses on making sure that people don't have easy access to highly lethal means during a moment of crisis. That's things like medication and firearms. And we work directly with the firearm community on those projects. So we are really looking forward to having more staff to assist and really take this project. Thank you, everyone.
right, housing. Just a small project. Obviously a huge goal shared between nonprofits, the business sector, the city, the county, commissioners, administration, even our state officials addressed this in the last legislative session. Have we done enough? No. There's more to do. And to achieve this goal of additional housing, it's going to require identifying specific needs and addressing them by gathering knowledgeable stakeholders around this common objective. We all know housing is too expensive. We know that we have a long ways to go, and it's going to take all of us. In the next 3 slides, what I'll share with you is progress we have made in the last year, and actually more than the last year. So, successes. Great job. Between December and June this past spring, we developed what was called the Move the Dial Action Teams. And leading that group was the Tri-County Housing Task Force that was operated out of the offices of the city. And I partnered with them to kind of reinvigorate that process. And underneath that team, we created 4 other teams intentionally, and a 5th team kind of cropped up organically. And I'll share those with you. We broke down the Tri-County Housing Needs Assessment Survey into 4 categories, and those were policy and planning issues that need to be addressed to improve the potential for affordable housing. We had a group that addressed the needs of vulnerable populations, and I'll talk more about those. We looked at density issues. How can we place fourplexes or duplexes in possibly what were single-family unit neighborhoods? So density issues was another team. Funding sources, and the 5th team that kind of cropped up on its own was a group called the Clergy Advocates. 8 communities came together and said, we know that this is a great need in our community, and we want to be involved in helping solve this crisis. And so far they have stepped up. Some of them are considering challenging them to offer their parking lots as safe parking spaces. And they're working together, putting together a static display, a photographic display that I'll talk more about, of some of our unsheltered population. And they are meeting needs through the shower program and other initiatives that individual faith communities are taking on their own. So those 5 groups have come together. And as I said, they met regularly from December to June. It kind of took a break here during the summer, and we'll begin to meet again in September. And what we'll do, the goal of these groups is to identify, each group can identify one specific goal and kind of work on that, achieve it, make some progress on it, move the dial, if you will, then we'll move on to other goals. All right, the Housing Task Force, as I mentioned, is kind of the lead team for this group. And we've, as I mentioned, kind of reinvigorated the purpose of that group. As you can imagine, during COVID, things kind of slowed down, not meeting as often. But Ann Pichette at the city, new housing coordinator, is organizing that group, and we're meeting even next week to begin talking about site planning for an emergency shelter. So that group is kind of coming back to life, if you will. So I'm going to count that as a success. One other thing we've done is identified gaps in services. It's apparent from our conversations. I'll just mention 3 gaps that we've identified. There's a need for a detox facility in our community. There is also obvious, and staffing is going to come up across the board in all of our areas, but additional mental health staff is needed to address the needs of our unsheltered population, as well as folks who are unstably or even housed. And then we've identified the need for a full-service, low-barrier emergency shelter. I want to talk about data. Data collection has been effective, but we did some things this year to try to dial up our data. This year's point-in-time survey held on January 26th. We identified 164 surveyed 164 unsheltered individuals. Now, it was a cold January night. Many of these folks were in places like God's Love, in hotels, and we were able to interview them. So I didn't come up with any sexy slides or graphs or anything for this, but do the math in your head. So we have 164 surveys that were completed. On that night, we also identified 40 vehicles or campers that were occupied, but for the safety of our surveyors, we didn't ask them to knock on the windows and interview those folks. We just counted the vehicles that were occupied. And the other thing we know is that there were at least 100 folks in hotels utilizing MIRA funds. So 164, 40, and 100, a little over 300 folks would have been unsheltered if not for MIRA, if not for their vehicles and our emergency shelters. So that's one piece of data that I want to share with you. And what we realize, and we can do better, but currently our FUSE program, that's frequent users of systems engagement, operating out of St. Peter's here, they're working on keeping accurate data, the clients that they're working with, and we also are trying to improve our data collection through the coordinated entry system. We have service agencies like Good Samaritan, God's Love, Family Promise, the Friendship Center. These folks are collecting data from the folks that they serve, and what we're trying to do is continue to improve our kind of raise the bar and the standards in that data collection, so we have accurate numbers of the people we're serving. And finally, raising awareness. Currently, our local HCTV is working on a documentary about our unsheltered population. And if I can remember what they call it, the title of it is Why Should I Care? And it'll be out, I believe they're aiming for December. They've been interviewing unsheltered neighbors and service providers to put together, I think, an accurate picture of the population here in our community. Coming up in October, one gentleman who's already done a photo project will be displaying October 9th at the Convergence, Mr. Bullock's new establishment on the Walking Mall. He'll be displaying some images of some of our unsheltered population that he took during COVID. And they'll have a conversation on a Monday night there at the Convergence. And then the following Friday, as part of the Housing is Healthcare Summit, we will be unveiling a brand new photo set of photos of our unsheltered neighbors and telling their story again through images. And so both of these are to help raise the awareness, and also, especially the second one we're going to be sharing at the summit, really to attempt to personalize and demythologize the public's thoughts concerning our unsheltered neighbors. they are not drifters passing through town. These are folks who, more than a few of them have had careers here in Helena and have just fallen on hard times. And so we want to tell their story and share that out. In terms of media access and raising awareness, we all know that these stories have been on the news regularly. Even our unsheltered neighbors have taken matters into their own hands. And we've seen the stories about our friends up at Orofino Gulch, the tent village up there, and the work they're doing to solve their own problems. And one last thing, our local business improvement district reached out to the United Way and asked us and work together to create a local guide to provide instruction for ways that our downtown homeowners and downtown businesses can approach and interact with our unsheltered neighbors. We created basically a series of steps so that their immediate reaction wasn't just to call 911, but rather to engage with the person, build a relationship with the person, call our friends at our street outreach folks at Good Samaritan, and then if necessary, possibly the non-emergency number at police department. And in the worst case scenario, there may be a need to call 911, but there are usually 4 or 5 steps that can be taken for that. Just to begin to treat our unsheltered neighbors with dignity and respect again. So, all right, challenges. Again, staffing. The pandemic has shifted the workforce in ways that we're still adjusting to across all of our agencies and businesses. Employee demand has never been higher. And one dynamic that has shifted has created 2 problems that could lead to creative solutions. And this is a national situation, but I'll bring it home. We know that across the country, there are empty office buildings, and there's also a housing crisis. And in many cities, they're looking at ways to repurpose those office buildings to create affordable housing for folks. In Helena, our iteration of that looks like potentially the St. John's Hospital building. It's a lot of space there. 100 rooms on the Rocky Mountain Care Center side. I think there are close to 300 rooms on the hospital side. This facility could be repurposed to, at least with the current zoning, create transitional housing. And we also have to consider ways that this building can sustain itself. So possibly some top floor condos. Who knows? There's a lot of ideas and creativity and kind of creating this solution. But and even with those solutions, and even as nonprofits look at the prospect of utilizing that facility, we still run into staffing challenge. So that's our first challenge. Funding. In several states, communities are facing similar challenges. And local governments and state governments are prioritizing and incentivizing the construction of attainable homes with tax dollars. Our funding action team is building a list of resources for people who are trying to access affordable housing, giving them a list of resources, grants that might be available, ways that they can apply, ways to get in line with folks like Habitat for Humanity. This effort is going to take private, government, and nonprofit efforts. And it's going to be a fundamental shift in culture for us to make room for housing and build housing that is, less than $400,000. So funding is going to take a significant shift. Another challenge. Third challenge I list is NIMBYism, and it's connected to raising awareness. NIMBYism is not in my backyard. And studies have shown that concentrating all of our low-income and unsheltered persons in a central location proves to create its own set of challenges. Therefore, establishing smaller settings like fourplexes in existing neighborhoods or designating 2 or 3 apartments in existing complexes or setting aside homes in new developments proves to be a more humane and affordable solution. This kind of thoughtful planning and broader understanding of the complexities of our overall housing needs will lessen NIMBYism as it arises. If, just for example, if I were to tell you today that we're going to put all of our unsheltered neighbors into an emergency shelter at the St. John's building, my guess is the residents of Broadway Street may challenge that idea because that's a lot of people in a small space and very likely not a good recipe for success. However, if we were to talk to this subdivision builder and this new apartment complex that's going up, and if you will, spread out the opportunities for our unsheltered neighbors and folks who are working minimum wage jobs trying to find a home, then we may have greater success by spreading that around. One of the quotes I like to share is that homelessness is not a choice, it's a lack of choices. And so I feel like our job is to provide as many choices as possible for these folks. So turning NIMBYism into YIMBYism, yes, in my backyard. And quite literally, and I'll get to this, but the ability to provide additional dwelling units on your property, in your backyard, in your side yard, whatever space you have, turn your garage into a accessory dwelling unit. These are creative solutions that we've got to look at. Data, utilizing our current system for tracking our unsheltered population requires teamwork across several organizations. And we struggle to get all of our agencies to use the system. It's not the most intuitive system, but putting that data in and keeping accurate records is important. And this is, again, related to staffing. There's high turnover in some of these agencies. Folks are learning how to use this system. It's called HIMIS, the Homeless Management Information System. And folks typically in our service organizations are, they're in that business to help people. They're not in the business to do a lot of paperwork and a lot of data entry and all that kind of thing. That's not their favorite thing. They want to be out there helping those folks. And so it's a challenge that we face, but I think the way to get them to do a better job of entering the data so we have accurate information and we can track folks who need the help is to help them understand that when they put in the data and we collect that data and we send it off to HUD and the other folks that look at that information, then federal resources and funding is tied to those numbers. So we need to accurately reflect the numbers of people we're trying to serve in our community. And the last challenge I'll mention is just lack of housing. I mean, it's obvious. Our greatest challenge is finding ways to provide more options for folks like, and it's a wide variety of customers. We've got voucher holders, folks who have vouchers, ways they can pay their rent, but there's just no rental property available. Or the landlord may not accept a voucher for whatever reason. We have renters. We have buyers of all income levels. And across that spectrum, the greatest need, and I wish I had these statistics right now, but hopefully in the future we will, the greatest need is at the lower end of the income spectrum. Folks that have never been unsheltered are showing up at our service agency saying, this is the first time I've ever been evicted. But they just, new property owner took management of my facility. They put some paint on the walls and doubled the rent. You know,
Yeah.
That's not an uncommon story. And finally, third slide, next steps. We have identified some goals for our action teams, and there's a reason I call them action teams. Maybe this is wishful thinking on my part, but I didn't want to form committees. And I called it Move the Dial because we've got to move the dial. I hesitate to say this, but our friends in Missoula did some of this work about 10 years ago, and because they did, they've made some progress. They're a little bit ahead of where we're at, and they're doing some good things. And I feel like what we're doing right now is laying the groundwork so that 10 years from now, we're not having these same conversations. Instead, we're working through solutions that are sustainable and practical for the long. So, goals for our action teams. A funding information page was one project for our funding group. We want folks who move to the community or are looking for homes to have maybe an information page about resources that are available if they need, some folks need, today renters want first and last month rent plus their, you know, it's 3 times, you know, it's unbelievable what they ask for. But this funding information page will give them information about how they can access some of these resources, who is helping with these kinds of things. Promoting ADUs, this density issue. How many folks could put an accessory dwelling unit on their property? And how can we make that an attractive prospect? How can we make that as easy as possible? Speaking with Ellie Ray at the city, I asked, how long have we kind of made room for that? And she said, it's 10 or 15 years ago that they changed the single dwelling unit policies. And so we could have been doing this for the last 10 or 15 years, and maybe it would have eased the burden now. But we need to help publicize that. And look, I know we live in Montana, we like our space, but you know, a little mother-in-law house out in back could be a college student's answer, a kid fresh out of college, starting a new career. Might be his first place, her first place, whatever. So ADUs, our density team can look at these things, and then creating shelter, creating an emergency shelter. A vulnerable populations team is going to be mobilized to help us work through. The city very graciously provided $100,000 recently to look at the prospects of emergency shelter. We need to be smart about what that looks like. And so we're going to utilize our vulnerable population team. And that team includes not just unsheltered folks, but disabled folks, young people aging out of foster care. There's just a wide variety of population. Folks who are coming out of Warm Springs, mental health facilities. All right, and finally, that data sharing improvement. Our policy and planning group may be able to help us exert some leverage on folks who, across our agencies, as I said, it's a struggle to get them to input data and things like that. We've got folks that just need some encouragement to be more active at putting the data in the system, so that week after week, as we are looking at names of people who are needing services, we're not looking at the same list of people week after week. When folks don't put that data in, it's not current data. And so we're hoping that we can exert some pressure on some of our agencies to be more diligent at inputting that data. So working on that. Also improve data sharing. We want to raise the level of expectation among our HIMSS users. And we also want to provide, and we can provide, ongoing training for those folks. Last couple things. The emergency shelter. As I mentioned, the subcommittee will be discussing site suggestions next week. And we're beginning to do the background work for how we're going to staff an emergency shelter, who's going to do that, who's going to provide oversight, what service providers will be engaged, and what will the policies be of this emergency shelter. There's a lot that goes into starting an emergency shelter. We're working on that. And the last thing I'll mention is additional staffing for our Housing First work. I wear a couple hats there at the United Way. Housing is not the only thing I do. So we're looking for possibly VISTA volunteer, or last year we had a University of Montana Masters of Social Work volunteer that came and worked with us. And we need to continue to build a team of folks with this expertise so that the data collection, the data we do receive, we need to be able to utilize that to leverage resources in our community. And also another project for additional staff. People ask us questions like, well, how many rentals are out there? Or how many places are being used for vacation VBRs or those kinds of things, because that takes a place out of service for a family that may need a home. So we have plenty of opportunity for additional staff. Thank you. I hope I didn't put you to sleep. Thank you.
We move over to the portal, the community health improvement portal. And while she's working on that, I want another round of applause because there's been some pretty amazing work happening in just a short amount of time. And so the Healthy Communities Coalition, and Sarah highlighted some of that work, Healthy Communities Coalition working on chronic disease and those goals and objectives in the CHIP plan. Thank you so much for all that chronic disease work. And thank you to the local advisory council on behavioral health, the Behavioral Health Systems Improvement leadership team, and Jolene and the Suicide Prevention Coalition, Jolene and Jess, who presented those successes and challenges. Thank you to you all. And then United Way for taking the lead on the housing conversation in this community, the great work in pulling partners together to move the dial. So thank you, and another round of applause for all of that great work. So I'm Brenda Neiman. I am the health officer at Lewis and Clark Public Health and get the privilege of being a part of this Healthy Together steering committee and working really closely with all of the coalition work that's happening in the community. So I wanted to kind of round it off here this evening and let those folks that are with us today and let the community partners or the community folks that have joined us virtually today know that the Community Health Improvement Plan can be found on the Lewis and Clark Public Health website. But we also have this really amazing portal. And so this is an interactive portal that it summarizes the work that's happening within the Community Health Improvement Plan, but it is also a really great touch point on the data. So what I will reiterate is that these 3 priority areas weren't just plucked out of the tree somewhere. We work really hard in this community to understand what the health indicators are telling us. We collect the data and look at that data every 3 years. We publicize a community health report that talks about all of the health indicators. And we as a community determine based on that data what those priorities are. That lends nicely to this community health improvement plan. And so that community health assessment or the community health report with all the data is also on the website. It's a nice beefy data book for those that like to look at the numbers and see graphs. And then that is where the community health improvement was born out of. And so on the portal, and if I can ask, just scroll. Yeah, just scroll down. On the portal, what you'll find is information about Healthy Together. You'll find information about the social determinants of health. You'll find information about each of our priority areas: chronic disease, behavioral health, and housing. And for each of these priority areas, what you'll also see is, just keep scrolling. So this is our Lewis and Clark profile. So it's going to give you a little snapshot about who are we in Lewis and Clark, what's our population, keep scrolling for me. It talks a little bit about education in our county, talks a little bit about housing in our county. So it gives you a little snapshot of profile of who's living in our county. And then it gets into each of these areas. So chronic disease has a very specific area, talks about nutrition, physical activity, and partnerships, and what strategies are specifically aimed to improving health outcomes in that area. And then you'll have to scroll and then hit OK with this to move this window out of your way. Right there. And you actually say, don't show it again. So this portal, it's interactive. And so we have a little tutorial here for you so that you can really get a lot out of these data dashboards that are in here. But for chronic disease in particular, what you see are the data trends that are specific to chronic disease. Because what we want to see is over the course of this 3-year plan that we're actually making a difference, that we're seeing a positive impact on people who live in this community and their health outcomes. And so we pay attention to the data. The data is available to you in this way. And that's true of the behavioral health priority area as well. You'll see those focus areas: prevention, post-prevention, resources, funding, locations, interventions, partnerships. It also will take you through all of the specific strategies of behavioral health. And then again, it'll give you the data that is connected specifically to behavioral health. It'll give you a sense of individuals who are sharing that they have felt depressed or a level of anxiety in the past 30 days. It'll give suicide rates in our area, marijuana use in our area. And then housing is the 3rd priority area. What you'll get again is the specifics of what the plan says, and then the data connected, the data that we have available. We know that there are gaps in data across all 3 of those priority areas, but the data that we have available is posted for you to see and for you all to monitor as we move through this plan. And then once you scroll past that, keep on scrolling. Lots of really great stuff. There's an area, keep going down to where it says getting involved. So here's your call to action. So if you are not already involved in one of these coalition efforts, I invite you to become involved. So on the portal, you'll see opportunities to get engaged with the community, Healthy Communities Coalition, working on chronic disease work. You'll see opportunities to get engaged with the local advisory council. You'll see opportunities to get involved with the work happening around housing. So here's your call to action. We need community partners. We need passionate people in this community to help us do this work. Not one agency. United Way can't do it alone. St. Peter's can't do it alone. But when we do it together, that's when the magic happens. Okay? When we work together, when we share resources, when we share expertise, we share ideas, that's when we can have a true impact on the health of the people who live in this county. So here's where you can find all the information about who to contact to get involved, and also to continue to monitor in real time what's happening with the Community Health Improvement Plan. So I'll stop there because there's plenty of time for questions and discussion. And so I do want, would you be able to monitor what's happening on the virtual platform?
Yep.
And then we can take questions or comments in the room, and then I will, yes, well, I'll do this now, but I'll come back to it again at the end. So on the tables, you will see a QR code and a go-to code. There it is. For those of you that are online with us today, again, a website or QR code where you can take a survey and give us some feedback on the presentation and also on the work that's happening in the community. So please take a minute to do that. And I'll remind you again before we're done. But at this point, I would really love to open it up for questions. We have our experts in the room, Sarah, Jolene, Jess, Jeff, who are leaders in this coalition work, to answer questions specifically that you might have.
Here's the grapevine that one of our local homeless shelters has kind of tightened up the requirements for being able to be part of that shelter. Do we, or does this group have some way to work with that, or some sort of prognostication of what that's going to look like, especially coming through colder months of this year?
Yeah, and Jeff, I'm going to ask that you come up and attempt to address that question. And I think you alluded to it in your presentation about the need for additional emergency shelter. And part of that is because the one emergency shelter that we have is not enough, first of all, and there's some stipulations of who can utilize that. So Jeff, would you like to elaborate a little bit more?
Sure. Our current shelter has housing primarily for men. They have 37 beds, but those beds are occupied solely, at least during the summer months, by folks who have jobs, folks who are employed as a requirement to stay there. They have about 7 beds for women, and upstairs there's a family program that has 9 rooms, and those are currently full right now, and they work closely with those families to try to help them find housing. With that employment requirement, they are often not at capacity. And folks are, well, I'll just say this. What that means is that I would consider our current shelter a medium to high barrier facility. Now, they do in the winter months, when it gets very cold, open their doors and allow folks to sleep on the floor just to get them out of the cold. The other challenge we have is because this is a privately run facility, we don't have a printed copy of their policies and procedures, and they are doing their own work, and it's hard to hold them accountable to the rest of the community because it is a privately funded operation. We receive some county funds to help with their operations, but they have their own set of operating procedures, which are sometimes hard to tell what the current policy is. So that is why we are investigating the potential for what we consider a low barrier facility, which would mean by low barrier, that may mean if someone is under the influence, they could come in and sleep it off or whatever. Low barrier also means that, well, folks with a variety of challenges could be accommodated. The other important piece that is missing from our current facility is service agencies would be at this emergency shelter providing services on a weekly basis, whether that means folks like AWARE, Many Rivers Mental Health, substance use agencies would be there. If not, having one-on-one conversations with folks with those needs, providing classes, teaching, and engaging folks regularly. Because just housing folks is not the answer. The answer is housing folks and meeting their immediate needs. And the reason we call our program Housing First is let's find some kind of housing for them and then address the needs they have. Hope that answers your question.
Thanks, Jeff. you have anybody online with a question or a comment?
Not yet.
Not yet. Thank you. So just maybe put a chat in or raise your hand and Haley will prompt that interaction. What other questions do we have in the room about the work that's happening? Or comments? Do we have any other comments that can be shared?
Have we seen any, I don't know, maybe it's too early to tell, but with the 988 rollout, have we seen any? I saw numbers higher contact, but have we seen numbers go down on suicides in the area?
You want to go ahead?
Maybe it's too early to tell.
It's too early to tell. It's also very hard to suss out, is it because of 988? Is it because of certain marketing? Is it because things are less difficult in the world? It's very difficult to be able to make those connections. So we need more years of data to be able to tell.
And Jolene, jump in, but the idea behind the 3 pillars is that they're actually building blocks as well. So we want folks that can be served by the call center to call the call center to get the help that they need. Kind of the lowest level of care, because it's on the phone. It's with a very highly trained individual that can help to figure out the situation in the moment. But if there's the need for a little higher level of care, that's when our mobile crisis response team gets involved, responds out to the location, helps in the situation. And then the highest level of care then is the crisis stabilization facility. So those 3 pillars really build on themselves. But what we know from other communities is that if we can get people who are in a mental health crisis or behavioral health crisis to call 988, most of the crises can be resolved through interacting with the professional that's on the phone, and they don't need to higher levels of care.
Yeah, so 84% de-escalated is just the standard for Voices of Hope. So that's a great mark. I mean, I think we're one of the highest, like I said, in Montana for de-escalation. But it's hard to make a link to that. I mean, and it's going to take, this is only the first year for 988. Yeah. So, and then we don't have all 3 pillars yet to be able to get somebody in. So luckily we have a St. Pete's with the behavioral health unit here, but they have a capacity that they can only fill so much. So there's a greater need in the community too for more services. And so being able to have that crisis facility could be a way to respond to people in your future, emergency shelter who are needing medical or, behavioral health treatment out in the community that, shouldn't be treated necessarily if you don't have behavioral health professionals on scene or medical, but in that outpatient crisis facility environment. So I think there's a huge potential to work together and build the system. I know we hear the same topics. Where's the funding to make these things work? So, we have to work within our resources. And so how do we put our hats on to think, how do we make this system work where we take a model of the crisis now model to develop the 3 pillars of the crisis system? How do we work with that and engage that in the community we're in? And to meet both, the rural areas and, our urban areas too. So there's a lot of challenges for sure we're trying to work through, and we welcome partnerships to think this out. So
It makes me think that one thing that didn't come up in the challenges is we have upstream issues with our state mental health hospital being, having its own challenges, and that has ripple effects across communities, across our state.
and that's
we're working through.
That's right. And I think that, that's why we often share with decision makers our information of what's available for crisis facilities that are regional versus just one state location. So people can be in their communities, their regions, and that would also maybe bleed out to the rural areas to have them have resources they don't have close by versus having their loved ones have to go 2 to 4 hours away from home. There's lots of opportunities to communicate the needs with some of the conversations that are going on with the legislative members in regards to the Commission for Future Generations for Behavioral Health Services. So
when we know that people tend to have a better likelihood of getting better if they are based in their own communities, we're also really looking at giving people the least restrictive, most appropriate level of care. So these pillars are really looking at that.
And cross-cutting all of the 3 priority areas of the Community Health Improvement Plan is access to care. So we're thinking about access to care when it comes to the housing situation, with behavioral health, of course, with chronic disease, making sure that individuals who are in need of care can access that care. And we know that workforce is a significant challenge. We know that in order to impact the suicide rate, we need behavioral health providers available. And that's a challenge in our community. I think we have amazing providers doing really great work. Many Rivers Whole Health, St. Peter's Health, Pureview Health Center, lots of really great efforts to make sure that services are available, but workforce continues to be a challenge.
Got a question, very different topic, but kind of a general one. So it's a 3-year program, is that? So what happens, I guess after that 3 years, what happens at that point?
Sure, that's a really great question. And so actually I'll take you back in time in order to answer your question. Our very first community health improvement plan was built in 2016. So we've been doing this work in our community for quite a while, for many years. And every 3 years we look at the data and build a plan. So the last 3 iterations of our community health improvement plan have really done a nice job of building upon each other. We've identified in every community health improvement plan since the very first, behavioral health has been identified as a priority. What we said back in 2016 about what we're going to do around behavioral health looks very different than what we're doing now, because we make these very nice integral steps forward. You can see progress being made. We know in public health that to change behavior and to change health outcomes, it's going to take decades. And so doing a plan every 3 years lets us take those baby steps forward. And then in the next 3 years, we look at the data. How are we doing? What are our priorities? What's the next baby step that we can take as a community? So yes, and in 3 years, we'll be doing it again. Or 2 rather, we're 2 years into a 3-year plan. So next year will be our community health assessment year. So we will do a brand new community health report with all updated data. And then on the heels of that will be in 2025, will be a new community health improvement plan.
Can I ask a follow-up question on that? How's that community assessment completed? I mean, what is all the demographics and things feeding into it? Who's a part of that process?
Absolutely. So it's the Healthy Together Steering Committee that drives the process. We have Dorota as one of the lead epidemiologists, and then the data guru from St. Peter's, and I think it was Autumn at the time, but it's probably since changed. So we get the data folks that know how to access data, secondary data, and then we look for ways to collect the primary data as well. In this next iteration, we're going to be doing the Casper assessment, which will collect primary data, which means we're going to do surveying door to door with residents in our county to collect information about health status. But otherwise, we're getting information from existing data sources. So the tumor registry at the state gives us information about cancer rates at the local level. We are getting the suicide data that is collected at the local level, feeds up to the state, we get it back again. So lots of different data sources we pull together into one report. So the current report is available online. You can look through it. It's a nice, robust report that goes through a lot of health indicators from asthma to economic. It looks at all of those social determinants of health. So what our economics are, what education levels are, housing. It looks at a lot of the behavioral health data. That helps. Did that help answer your question?
Yeah, that helps a lot.
Yeah.
I appreciate it.
And again, every 3 years that gets updated because we hope to see an improvement in health outcomes in our county based on the work that we're all doing collaboratively. Questions, comments, anything online?
This is more of a suggestion, but I'll try to pose it as a question, I guess. When you call like the state DPHS office for like food stamps or things like that, you know, and you're put on hold for a long, long time, they basically are, sorry. The one time that my phone rings. You know, you're on hold for, you know, half hour, 45 minutes minimum most of the time. And they say that if this is an emergency, call 911. You know, maybe somebody could talk to the state about putting a little plug in there for the 988 system that if people are in crisis, because a lot of times when they're waiting on the phone for an hour, they're already in crisis and they're calling these phone systems, and the phone systems they've got all kinds of bugs in the system.
Right. That's it.
I think the hospital may actually have the same basically thing in their thing. So if they could put a plug in there for the 988 number, because the 911 is getting overloaded with people that could be redirected to the 988 system.
Yeah. And thank you. That is actually work that the local advisory council has been attempting to do. And there are a couple of agencies that took the lead, and I'll point Peerview as one of them. They were one of the first to change their messaging system to say, if you're in a mental health crisis, call 988. So if we could get more agencies, including those helping agencies that the state has, to redirect to 988, I think that's a work that we absolutely can do in this community. It doesn't take any effort to change a voicemail message and direct to 988. Thank you, Brian.
I am very impressed with the work that the three groups have done. It just blows my mind to see, and it really touches me to see how much Helena cares about the community. I mean, I'm getting goosebumps just thinking about the effort and the work that you people have done. There's so much love. And I'm a member of it's going up to my head. I'm a member of the League of Women Voters, and I will tell them all about your work here. And we have men who have joined our group. It's not only women, and we are concerned about our community too. We are a nonpartisan group, and I volunteered to be in charge of the mental health committee to see how we can collaborate with the mental health efforts in our community. And so I have a lot. I don't know how I'm going to explode, but to just tell them about what you guys are doing. This is just, it's so touching. I'm just all chilled up.
Well, thank you. And
thank you so much for your work.
Thanks for passing the word, because we need more help. So thank you.
We have over 100 members but they're mostly in their 80s. I mean,
we'll take it.
We want young people in our group, but they can spread the word. Our group, we're very active women.
And wise. So that's important. All voices are important in this.
I just wanted to say thank you for all your hard work.
Thanks, Ruby. Brian?
if the League of Women, the LAC is a great place to go get a lot of information because we really need the league to participate in what's going on at the LAC because every year we need to take information up to the legislature so that we can get funding for all the programs that are doing the most good in the communities.
Yeah, they do a lot of work in that area too. So it's a great group to connect. So Philomena's been trying to get to our meeting. So hopefully she's here today instead, but we'll get her there.
Our women are very active in the legislature.
Yeah, I'm
Very, very active.
A lot of advocacy that can be happening.
Yeah.
Yes, in all three of these categories of work. Anything online, Haley? Nothing online? Nope. Okay, I'm gonna. Commissioner, any thoughts, comments? Thank you for being here.
yes.
Emily?
Just working on the iron front issue, so. More housing, please.
Oh, boy.
Like 30 or so units tomorrow. Thank you.
Anything more here? All right, so one last reminder, we would really appreciate if everyone would take just a minute and fill out the survey. It's a few short questions. It gives us feedback on how we did as far as the presentation was concerned, but also the work that's happening in this community. There's an opportunity for you to give some feedback on the work itself. So please take a moment, fill out the survey. And thank you. Thanks to St. Pete's for the space. This is a really, really great space, and it's always nice to have community members in the space working together. And the refreshments, it looks like there are still some pretzels and cheese and cookies back there, so help yourself to refreshments. So thanks to St. Pete's again. Thank you so much to the 5 coalitions that are doing the work, and the leaders who came to present the successes and challenges. Thanks again. And all of you who took time today to come and learn about the work that's happening. We hope to see you all engaged in this coalition work as we move forward. So. How's your day?